child with big round eyes you think is cute but could mean more. We are talking Buphthalmos, also called bull-like eye, also called ox-like eye. Bu bull ophthalmos eye. Okay, so it's a form of primary congenital glaucoma. Primary meaning it's just caused like that. Okay, uh, congenital meaning it's present since birth, and glaucoma meaning there's raised IOP, and because of the raised IOP there's other complications in the eye. And Buphthalmos or primary congenital glaucoma is mainly sporadic, but can have autosomal recessive inheritance and bilateral in 70% of the cases. So we see here the eye of few kids which are round, big, and this is compared to that of that of a bull. So it's called bull-like eye. The main problem is trabeculodysgenesis. What is trabecular? What is dysgenesis? We'll see. First, we'll understand the structure of the eye. This is the sclera which continues as cornea. This is the choroid which has ciliary body and which extends forward as the iris. And this is called the angle of the eye. Why is angle important? Aqueous humor is secreted by the ciliary body. This passes from here, passes to the pupillary aperture, which will be here, and enters the anterior chamber, which is this is what we call anterior chamber. And from here it enters the trabecular meshwork, the tiny holes that we see here. From here it enters the canal of Schlemm, a big canal which basically collects all of the fluid, and from here the aqueous goes to the episcleral veins, vessels, all of this. Okay, so this is the angle of the eye. The problem in glaucoma is there's increased aqueous humor because of inadequate drainage of the aqueous humor. In trabeculodysgenesis, which we see in Buphthalmos, the trabecular meshwork is abnormally covered. Covered by what? Normally, iris is supposed to insert somewhere here close to the ciliary body and never over the trabecular meshwork. But if the iris covers the trabecular meshwork, so instead of being here, if the iris covers the trabecular meshwork like this, the whatever aqueous humor is which is formed has nowhere to drain, right? It keeps on accumulating here. So this is the main problem that we see. So this iris, abnormal iris insertion is over the trabeculae is called trabeculodysgenesis. There's flat iris where the iris is flat here, or concave iris where the iris creates a cup shape and inserts. So the basic problem, right? So because of accumulation of all the aqueous here, the cornea is affected. The cornea keeps on stretching, and when this stretches, the cornea breaks. So there's endothelial damage of the cornea, and because of endothelial damage, aqueous can go into the cornea. So this causes corneal edema. Cornea swells. Okay, this corneal edema is the main culprit. This corneal edema can activate the trigeminal nerve, and this trigeminal nerve activation leads to certain things. It activates certain reflexes, involuntary reflexes, which causes the classic triad of Buphthalmos. That is, when it stimulates lacrimal gland, it can cause increased tearing, that we call lacrimation, increased lacrimation, and there's sensitivity to bright light, which we call photophobia, and there's involuntary eyelid closure because of orbicularis oculi muscle activation, which we call as blepharospasm. So classic triad of Buphthalmos: increased tearing, photophobia, blepharospasm. So corneal edema appears like this on slit lamp examination, and the cornea keeps on stretching, and there is edema of the cornea. This creates hazy cornea, which we call frosted glass appearance, and there's breaks in the decimates membrane of the cornea because of all the stretching. There's Habs striae, and this stretching of the cornea, stretching of the whole eyeball stretches. Okay, so this stretching of the cornea increases the corneal diameter. So there's corneal enlargement more than 13 mm in diameter, and this stretching of the conjunctiva makes the scleral vessels underneath more visible, so that there's blue appearance of the sclera, blue sclera. What are the other features that we see here? The other features we see here are a flat lens. Okay, so there's deep anterior chamber because of all the accumulated aqueous humor. Because of this, there's increased IOP, right? And the whole eyeball enlarges, and this front to back enlargement of the eyeball. So there's increased axial length, which can predispose these children to be axial myopes, right? So these are the various problems or clinical features that we would see. Treatment. medical treatment with drugs is not definitive and it's very temporary. You could control the IOP till the surgery happens, that's all. And some drugs are contraindicated, some anti-glaucoma drugs are contraindicated in children. So we do not prefer medical treatment as a mainstay treatment. Surgery is the mainstay treatment. Main problem here in what we saw in Buphthalmos was abnormal trabecular meshwork being covered abnormally by the iris. So aqueous had nowhere to drain. So how can we tackle these problems? If we could make a cut in the trabecular meshwork so that the aqueous drains, we could do that. Or we could create alternate pathway for the aqueous to drain. That could also happen, right? So these are the surgical modalities. With incision at angle, we have two types. One is goniotomy and the other is trabeculotomy. We'll look at each of it. Goniotomy, gonio refers something at the angle of the eye that we saw here, this angle, right? Tomy meaning making an incision there. So what we do here, we use a Birken's goniotomy knife. So the knife looks something like this. It's like a scoop shaped knife with a curved end. Okay, the curved end goes down like this, it goes, okay, at a 75-degree angle it cuts, right? So what we do here, this is to orient yourselves, this is the cornea and this is the temporal side, this is the nasal side, okay, the medial, the lateral side, the medial side, temporal or and this is the nasal side, right? The goniotomy knife, Birken's knife, is inserted from the limbus. Limbus is basically junction of cornea and the sclera, right? So from there on the temporal side it's inserted and it passes through the eye, straight through the eye, and it where you reach is the angle on the nasal side, angle of the eye on the nasal side, and here it cuts between the Schwalbe's line and the root of iris. So we'll see what this is, right? This is the angle is formed by certain structures which we call the root of iris, and there's a part of the ciliary body which can extend, and there's a scleral spur here, then we have trabecular meshwork here, there's canal of Schlemm which drains, and then there we have the Schwalbe's line which is basically the continuation of the posterior lining of the cornea. So the goniotomy knife goes and cuts between the root of iris and the Schwalbe's line. So what we are doing is trabecular meshwork is cut, right? So the aqueous can drain through this cut. So the goniotomy knife cuts between the Schwalbe's line and the root of iris. So for this, you need to be able to see where the needle is going and where it's cutting. So we need a clear cornea. A clear cornea is an indication for goniotomy. Right? It's a necessity for goniotomy to be done, and a cut is made here and it's extended, right? This is goniotomy. In case you have a hazy cornea or not a clear cornea, you do what is called a trabeculotomy. Trabeculotomy is done using a Harm's trabeculotomy. So the instrument looks something like this. So there's a curved stick like end here, okay, with two parallel sticks, okay. What happens here is you are making a cut. Schlemm's canal, is a canal. The instrument is the Harm's trabeculotome is inserted through the Schlemm's canal. The lower part is inserted through the Schlemm's canal, and this is the inner lining of Schlemm's canal, this is the outer lining of Schlemm's canal, and then you rotate this such that the inner lining of Schlemm's canal is ruptured. So it tears the inner lining of Schlemm's canal. So this exposes the anterior chamber with that of the Schlemm's canal directly, so the aqueous can drain into the Schlemm's canal. So this is trabeculotomy. Schlemm's canal is cut, is trabeculotomy. So we see here. And why do we need a hazy cornea? Why do we prefer this in case of hazy cornea? Because you see here there's a lower rod and then there's a upper part for the instrument. The lower part goes to the Schlemm's canal, right? As we see here, lower part goes into the Schlemm's canal, and this is the upper part is parallel with the lower part of the instrument. So when this rotates, this also rotates. So we visualize the rotation of this through this. So this is on the outside of the eye. When we can see how much this has rotated, so that we can identify how much of the Schlemm's canal has been cut, right? That's the sole purpose of having a upper part of the device, and that's why we prefer this in case of hazy cornea, when we can't see through the cornea. And this trabeculectomy, it's a filtration surgery where we create alternate pathways. What we do here is incision is made and a pathway is created between the anterior chamber and the subconjunctiva. This is the conjunctiva, right? Anterior chamber is this. So a pathway, normally it would go like this, but here it goes like this. A alternate path, because this is not working, you just don't touch it and you create an alternate pathway for the thing to drain. So we drain it from the aqueous chamber to the anterior chamber to the subconjunctiva. So when you do this, there can be formation of a, so we see the path here from the anterior chamber to the subconjunctiva. So when fluid drains from here to here, the conjunctiva keeps on increasing. Fluid builds up in the subconjunctiva, and there's a bleb which is formed. So what we see here is called a filtering bleb, and from this bleb, the fluid can diffuse into the conjunctival vessels or the scleral vessels, right? So this is trabeculectomy, and with trabeculectomy you need to give anti-metabolites such as mitomycin C or 5-fluorouracil. These inhibit fibroblast proliferation so that there is no scarring or path closure. We created an artificial path here, and in case of children there's active healing, so this active healing can cause fibrosis of these parts, and the pathway can get closed, so there is no use of the surgery. So to complement the surgery, we use antimetabolites so that the pathway remains patent and the drainage keeps on happening. This is trabeculectomy. Then we have glaucoma drainage devices. So these are devices which are inserted and in the eye, which connects the anterior chamber to the subconjunctiva, right? Similar to trabeculectomy, but we place a device here. This device drains the aqueous. That's all. And they can be valve device or they can be without valve, okay, valved or non-valved, and the various ways. When the valve is activated, the valve opens and the drainage occurs, and the valve is closed, it just keeps on building up. So the valve opens when there is a particular pressure which is reached, and then it drains, right? So these are the certain things that we saw for Buphthalmos, also called Buphthalmos, also called bullseye. The triad being lacrimation, photophobia, and blepharospasm. Surgery is the main treatment. We have under surgery, we have goniotomy if there's a clear cornea, trabeculotomy if there's a hazy cornea. Trabeculectomy is more preferred because it's more definitive. Trabeculectomy with trabeculotomy is even more preferred, right? And along with it, antimetabolites has to be given, and glaucoma drainage devices are also another treatment option. Bye. Thank you.